Good morning and welcome to January's edition of CSG University's Spotlight On. Today we featured Dr. John Vitolo of Skyview Orthopedics, who gave a wonderful presentation on diagnosing knee injuries and treatments. So welcome, Dr. Vitolo.
Thank you.
What a great turnout we had today and a very comprehensive presentation. Some of the things you talked about, obviously many Americans do suffer from knee injuries, and you mentioned they have the second most common type of workplace injury. What are some of the most common types of knee injuries?
I think usually most of the most common injuries are the more minor injuries, tendonitis, re-aggravation of arthritis. But I would say the most common significant injury is probably the meniscal tear. Yeah. And usually twisting, accidents, carrying loads down inclines, repetitive squatting, kneeling, things like that. So I would have to say meniscal tears are the most common.
And you see this not only in workplace injuries, but this can happen in auto injuries?
Absolutely. I think the biggest risk factor in the auto is that deceleration injury, when the car is either struck by another vehicle or hits more of an immovable object, and there's axial load on the leg and there's a torsional force. So it's kind of similar to skiing, things like that. So yeah, actually automobile injuries, ligament injuries, fractures, and meniscal tears.
How are knee injuries most commonly diagnosed?
Obviously, the first is the patient's history. Getting a good history, what happened, the mechanism of injury, that's the most important. The second is the exam. I think you get an inkling for what the injury is or the pathology is, then you confirm that with the exam. And then finally, the tests, the x-ray, the MRI, things like that, to verify your findings on exam.
Okay, and obviously there are various ways of treatment. What are some of the ways that you determine whether surgery is the more viable option or versus conservative care?
It depends on the injury, but for the most part, once you have all those facts, the history, the physical, the MRI or x-ray findings, then it's a kind of a sit-down or a discussion with the patient, what their goals are. Some people are hot for surgery, want to have surgery. Other people are surgical phobic.
Right.
So I think the most important thing is explaining to the patient what the problem is. Sometimes surgery is the better option.
Right.
Sometimes and that's the gestalt and the experience of the surgeon. But I think it's a consultation with the patient, the surgeon, and then deciding what their goals are, and explaining them what they have to go through, whether it's surgery or non-surgery.
What are some of the more recent advancements in ACL surgery?
ACL surgery, is probably one of the most common thing people ask about, talk about. There's an epidemic of ACL injuries. Young girls in high school sports, men in soccer, and boys in high school sports. So every high school probably has a handful of every season of athletes who get injured. So it's a very common injury. Basically, what's been described over the past few years is a more anatomic approach to the ACL. It used to be every person had their ACL reconstructed in a similar fashion. Now it's the location of attaching the ACL to the tibia and the femur have been refined. There's been several anatomic studies showing how to do that. Two is the type of graft selected. You could use the patient's own tissue. You can use donor tissue, and that would be dependent on activity level, age, many factors. And same as we talked about earlier, consulting with the patient. The older patient may want to use donor tissue, the younger patient their own tissue, depending upon the situation, their general medical health. And then finally, what their goals are. Some people want to return to high-level sports. Other people, that's not important. So all those factors, the anatomic, the size of the ACL, their activity level, what they want to accomplish are all important.
Very good. And what are some advice that you give to your patients when they are recovering after the surgery? What are some of the types of things that they should be doing to expedite that process?
I always try to preface any treatment plan with what they need to accomplish. I think it's the biggest thing is understanding the challenge that they're facing, because any injury is not a fun thing, and they're in pain. They can't do the things they normally do. So I think the best thing to do is map out the treatment plan. I think they appreciate that. I think they're more successful with the treatment when they understand what they have to accomplish. And if you look at any of the professional athletes who overcome knee or any type of orthopedic injury, they always say how difficult it was to get that mindset. So I think that's the most important thing. Mapping out the treatment plan, having them understand what they have to accomplish. And I think if they understand that before they enter into the treatment plan, I think they're much more successful.
Very good. Well, thank you again for your time today.
Thank you. It was my
thank
pleasure.
you. Have a great day.